Salam and hello everyone. Our group will present video practical test on blood withdrawal collection. Our group consists of Aimi Kafida binti Zulkifli, Alia Najiha binti Ramli, Amira Ashikin binti Muhammad Rosli, Khadijah Anis Afifah binti Muhammad Imran, and Nur Faiza binti Muhammad Hassan. Me, Amira Ashikin, will present about introduction and conclusion.
In general, phlebotomy is the process of making an incision in a vein with a needle through a process known as venipuncture. It divided into two, which is open system and closed system. This is the first step in acquiring a quality lab test result for any patient in specimen collection procedure. The venipuncture procedure is complex, requiring both knowledge and skill to be performed. Next, capillary or dermal puncture is used for the blood collection from infants, small children and adults in whom veins may be difficult to find. Area of skin puncture are ring or great finger, infant heels and earlobe.
Assalamualaikum warahmatullahi wabarakatuh. My name is Aimi Kafida binti Zulkifli and today I will explain about the principle and objective of the blood withdrawal collection experiment. We go on with the principle first. The principle of this experiment is the patient's request forms for test should be read and checked properly. The test requested should be noted carefully. After collecting specimen, all containers must be labeled properly, giving full details of patient's identification. Blood specimen should be collected properly to avoid errors in interpretations. We go on with the objectives. So we have two objectives for this blood withdrawal collection experiment. The first one are to identify the potential sites for blood sample collection, and the next one is to perform venipuncture and capillary puncture.
Hi, I'm Khadijah. I will explain about methodology and method. For this experiment, we have two procedures, which are venous puncture and capillary puncture. First, let's take a look at venipuncture procedure. Venous puncture is a direct puncture of veins by venipuncture. For this procedure, we need evacuated tube, barrel syringe, hydrodropic needle with a safety cap, transferer box, gauze, alcohol swab, and tape. After asking your patients for identification and prepare them for the procedure, and also washing your hand, it's important to wear gloves and disinfect the site of vein to be punctured. Keep in mind to already have the site chosen before applying the tourniquet. Apply the tourniquet 3 to 4 inches above the collection site and then swiftly insert the needle through the skin into the lumen of the needle should form a 50 to 30 degree angle with the arm surface. Slowly pull the syringe back. Don't pull it too harshly. Just let it fill. When the syringe has filled, remove the tourniquet and remove the needle from the patient's arm using a swift backward motion. Place gauze immediately on the puncture site. Apply and hold adequate pressure to avoid formation of hematoma. After holding pressure for 1 to 2 minutes, tape a fresh piece of gauze or band-aid to the puncture site. Now we move on to capillary puncture. Capillary puncture is used for blood collections from infants, small children and adults whose vein may be difficult to find, such as elderly, obese and severely burned patients. Here on the screen, I have put a common capillary puncture sites. For capillary, the procedure is the same as venous. Wash hands, wear gloves, disinfect and dispose, but there are a few things to remember. Finger stick procedure. instead of the tip of the center of the finger, use the purplish area marked in the picture. Second, remember to massage the finger toward the selected site prior to the puncture. And lastly, wipe away the first drop of blood. It is contaminated with tissue fluid and therefore it will dilute the specimen. For heel stick procedure, it's important to pre-warm the infant's heel to increase the flow of blood collection. However, the time should not exceed 42 degrees Celsius.
That's all for my part, method and methodology. I'll pass on to the next person.
Assalamualaikum and hi, I am Alia Najiha and I will explain to you about the result of the experiment. For the collections of blood sample, there are two procedures. Firstly is venipuncture. Let us discover the result of the experiment. But before that, we have to choose the suitable site to puncture, as it will affect the result of the blood. Or else you will feel the pain and scream like this. Just joking. The best site for the vein puncture is at a larger and fuller medium cubital of cephalate vein of arm, and also can get from the basic vein of dorsal of arm and dorsal hand vein. Second procedure would be capillary puncture. It is used to minimize the amount of blood drawn from a patient. 10 to 20 microliter can be used to look for anemia, check blood sugar, or even to elevate thyroid function. Best site is finger. Usually, the third and fourth finger is preferred in adults and children. Second is heel, that usually used for infants whose fingers are too tiny, and also earlobe, but this way is no longer recommended as earlobe has less blood flow than the fingertip. Watch out for the error and precaution. As you follow the procedure, you will get the best result of blood sampling, like this. And after the procedure, you will cry like a baby because you still feel the pain. Too bad. But it won't happen if you choose the wrong site to puncture, and all of the blood sampling will be sent to the laboratory analysis. It is important to know about plasma and serum, so you could differentiate your blood sampling in anticoagulated or clotted form. Plasma is an anticoagulated form of liquid which is a cell-free part of blood that treated with anticoagulant, while serum is a liquid part of blood after coagulation.
Hello everyone, I'm Faiza. I will explain to you guys about the discussion part from this experiment. The order of blood is very important. The major reason behind establishing a certain order of draw when doing venipuncture for multiple tube collections is to avoid any cross-contamination of the chemical additive between different tubes. Cross-contamination of this additive can massively change the results and may consequently lead to misdiagnosis and mistreatment of the patient. The Clinical and Laboratory Standards Institute recommends this order of draw for evacuated tube collection system. First, blood culture tubes. Second, coagulation tubes. Third, non-additive tubes. And lastly, additive tubes. The correct site of blood withdrawal is very important. For the finger stick, the best location for finger sticks are the third and the fourth fingers of the non-dominant hand. Do not use the tip or the center of the finger. Avoid the side of the finger where there is less soft tissue, where vessels and nerves are located, and where the bone is closer to the surface. The second finger tends to have thicker, callous skin. The fifth finger tends to have less soft tissue overlying the bone. Avoid puncturing a finger that is cold or cyanotic, swollen, scarred, or covered with a rash. Puncture finger across the fingerprint so blood will build up into a round droplet. If you puncture finger in line with the fingerprint, the blood will flow down the finger in a messy fashion. For the heel stick, heel is the recommended location for blood collection on a newborn baby or infant. The diagram indicates the recommended site and direction of infant heel puncture to use for blood collection. Next, let's identify the areas to avoid when choosing a site for blood draw. Number 1. Arm on the site of mastectomy. The test result will be inaccurate because of the limb edema. Number 2, scarred or burned area. It is difficult to puncture the scar tissue and obtain a specimen. Number 3, arm in which blood is being transfusion or IV cannula. The fluid in the IV could dilute the specimen. Number 4, a hematoma. Hematoma is the abnormal collection of blood outside the blood vessel due to damage of blood vessel, artery, vein or capillary. This can cause incorrect test results. Number 5, edematous. Edema is swelling caused by fluid retention. So, this should be avoided because the accumulated fluid could alter the test results. Okay, now let's move on to the techniques to prevent hemolysis. Hemolysis is a condition when the red blood cell is rupturing and releasing the contents into the surrounding fluid. Mix all tubes with anticoagulant additive gently. Vigorous shaking can cause hemolysis. Avoid drawing blood from a hematoma, so we need to select another draw site. If using a needle and syringe, avoid drawing with the plunger back too forcefully. Make sure the venipuncture site is dry before proceeding with draw. Avoid a probing, traumatic venipuncture. Avoid prolonged tourniquet application, which is not more than 2 minutes and less than 1 minute is optimal.
I will be present the last part, which is the conclusion. In conclusion, performing venipuncture requires step-by-step procedure to make sure the venipuncture process is successful. When collecting blood from vein, hemolysis can be happen due to several reasons like wrong vein selection, contamination and incorrect needle size. The order of draw when doing venipuncture for multiple tube collection is to avoid any cross-contamination of chemical additive between different tubes. Several precautions also must be taken when performing blood collection. And blood collection is vital to the correct diagnosis, treatment and monitoring of patient's condition. I think that's all from us. Thank you.